Now, people with autism are stigmatized in many communities across Africa, with the condition often being misdiagnosed. In Tanzania, for instance, some families hide their autistic children indoors for years, embarrassed at what people might think of the children's behavior. But efforts are underway to explain the condition and encourage people to deal with it. Focus on Africa's Sami Awami reports from Dar es Salaam.
Limited in communication, Prince finds great comfort in gardening. His mother, Hilda, says he also enjoys baking, and he is good at it. Hilda says seeing Prince happy gives her so much satisfaction, as raising a child with autism is never short of challenges.
A lot of time I look at him in disbelief that he's actually grown up to be this amazing young man. People have said all kinds of crazy things. Some neighbours have said behind my back that I bewitched Prince to get this house. Those kinds of accusations.
Autism is a neurodevelopmental disorder that often results in impaired social interaction, as well as difficulties in verbal and non-verbal communication. Awareness among community is said to be the major challenge here in Tanzania. And now therapists, teachers, students and their parents are joining hands to address it. And their message is clear: let's protect them and let's love them. Figures on autism prevalence in Tanzania are difficult to come by, but the impact of the condition is not. Nationwide, there's only 8 public schools for children with autism. Most of them are dire, have severe shortage of teachers and resources.
Each student needs one teacher because of their condition. So when a teacher has more than one student, she can't serve them properly. We're having a very difficult time now because there are only 2 teachers here.
Health services are not any better. There is scarce of specialists and often difficult accessing clinical services.
First of all, the assessments. We don't have proper assessments for children with, to assess children with autism in Tanzania in Swahili language. Yes, definitely there are assessments in English, and we use those assessments, but these assessments are not appropriate tools for the Swahili population, because like in those assessments they're like flashcards and they have snow in it. Now Swahili population has not experienced snow before.
Raising awareness of autism could see many more under-organized cases being recognized. But for that to happen, much more investment in specialist health services will need to take place too. Sami Awami, BBC News, Dar es Salaam.
Professor Petrus de Vries is a professor in Child and Adolescent Psychiatry at the University of Cape Town and joins us now via webcam. Thanks a lot for talking to us, Professor. Now, some of the kids we've seen in that VT are at one end of the autism spectrum. We should say that others can perform highly.
Of course, yes. Autism is very much a spectrum, and I'm sure most of your viewers would have heard of us talking about it as an autism spectrum. So by that I mean some kids might be profoundly impaired and not have any language and never develop language, and others might be very able and have very complicated language, and some of them might even end up being professors and mathematicians and other highly skilled professionals.
But why do you think the condition is so misunderstood on the continent?
You know, I think there's a combination of factors. If we just start with a stark fact that 90% of what we know about autism comes from 10% of the world's population, and that is from high-income countries. And yet, almost everyone who has autism live in low and middle-income countries like in Africa. And so I think the fundamental problem is that we simply don't know what autism looks like in Africa, and we simply don't know what families need with autism in Africa. We heard on your VT about stigma and about not having access to resources and about the cultural challenges of understanding and intervening with autism. So I think there are really multiple levels, all the way from priorities in health to skills to awareness. And I was delighted to hear that at least here's a group in Tanzania trying to raise awareness about autism.
Well, I guess that also kind of means that we don't even have a clear number of the number of people with the autism condition living in Africa. But what can be done to help those people who know very little to learn more about it from the few people like you who are trying to disseminate information on this?
Yeah. So the first thing to say is there's no replacement for awareness raising. And I think awareness raising can be at an individual level, in communities, including healthcare professionals and other professionals, because it applies as much to teachers and nurses. But we must also do the same with government. And so, for instance, we know the World Health Organization are really trying to lead an effort to raise awareness, but each person who lives with autism in Africa have a role to play in awareness. The next thing I think is we really must think what we can do about training. The training needs are vast, from parents all the way up to governments and professionals, etc. And that's a huge job for all of us to do. I think if we think about developing services, we must understand the needs of people in Africa to develop those services. And they can't look the same way that they do in high-income countries. We need to find what will work for people in local communities. As you know, and as we've seen, most parts of Africa are very different from what it looks like in terms of accessing services. And I think it's super important for us to think how we manage and understand stigma, because stigma in autism is as real in Tanzania as it is anywhere. In Cape Town in South Africa, people will think of it as a highly developed city, but we have as much stigma and the same thoughts that people are bewitched, that it's caused by curses. So it's important that we understand that we don't deny those thoughts with families, but that we engage with them to help them understand what can be done. And I think it's a really important message that we need to also give to people in our communities, that yes, we need to love, and what was the word that the person on the VT said, love and protect our family members with autism. But there are lots of interventions, there are lots of things we can do to improve the core dilemmas and core difficulties that people with autism have. And so I think research and finding strategies to bring interventions, to bring knowledge, to bring what works for people in Africa to communities where they are, I think is really something we need to do.
Professor Petrus de Vries there, speaking to us from Cape Town. Thank you.